Good morning, everyone, and welcome to our presentation on comprehensive airway clearance therapy. Today, we'll be exploring various techniques, devices, and clinical applications designed to improve the clearance of respiratory secretions and enhance lung function. I'm excited to share with you an overview of these important methods that play a crucial role in respiratory care. Let's dive in. Airway clearance therapy refers to a range of methods designed to help patients remove mucus and secretions from their airways. This is especially important for people with conditions like COPD, cystic fibrosis, and other diseases where mucus builds up or the body struggles to clear it naturally. By effectively clearing these secretions, airway clearance therapy helps improve breathing, reduce infections, and enhance overall lung function. Understanding this therapy is essential because it supports better respiratory health and quality of life for those affected. Patients with neuromuscular conditions often struggle to generate the strong, forceful cough necessary to effectively clear secretions from their airways. This can make airway clearance particularly challenging, increasing the risk of complications. One approach to manage this is by using an artificial airway, through which secretions can be suctioned out directly. While this method can be effective, it is invasive and requires careful monitoring. Another option is manually assisted coughing, where physical techniques are applied to help mobilize secretions. Additionally, mechanical insufflation-exsufflation, or MIE, offers a non-invasive alternative by simulating a natural cough, helping to clear the airways more efficiently. Both these methods aim to improve secretion clearance and reduce respiratory complications in these patients. When we talk about manual assisted coughing, one key technique to understand is what's known as quad coughing. Essentially, quad coughing involves applying pressure externally to either the chest area or the upper abdomen, the thoracic cage or the epigastric region, while the person simultaneously performs a strong, forced exhalation. This combination helps to clear the airway more effectively, especially when someone has difficulty coughing on their own. It's a simple yet powerful method to assist with airway clearance. Mechanical insufflation-exsufflation, or MIE, is a valuable tool for patients with certain neuromuscular diseases. These conditions can weaken the muscles needed for coughing, making it hard to clear secretions from the lungs. MIE helps by generating enough expiratory flow to assist in effectively clearing these secretions. This is crucial because effective cough and secretion clearance reduce the risk of respiratory infections and complications. The American Association for Respiratory Care recommends using MIE when cough peak flows fall below 270 liters per minute in patients with neuromuscular diseases. This guideline helps identify when MIE can be most beneficial in supporting respiratory function. Mechanical insufflation-exsufflation, or MIE, is a technique designed to help clear the airways effectively. The first step involves applying a positive pressure of about 30 to 50 centimeters of water to the airway. This pressure is maintained for 1 to 3 seconds and delivered through either a face mask or an artificial airway, helping to inflate the lungs. Next, the device rapidly reverses the pressure in the airway. This sudden change creates a quick shift from positive to negative pressure, which helps to mobilize and loosen secretions. Finally, the airway pressure is held at this reversed level, again between 30 to 50 centimeters of water, for 2 to 3 seconds. This phase assists in expelling the secretions out of the airway. Together, these steps simulate a natural cough mechanism, making it easier for patients with compromised cough strength to clear their lungs. Mechanical insufflation-exsufflation, or MIE, involves a 3-step process designed to help clear the airway effectively. First, the device applies positive pressure, typically between 30 to 50 centimeters of water, to the airway for 1 to 3 seconds. This can be delivered through a face mask or an artificial airway. Next, the device abruptly reverses this pressure, switching to a negative pressure in the same range, also lasting 2 to 3 seconds. Finally, this cycle of applying positive pressure followed by negative pressure works to simulate a natural cough, helping to clear secretions from the airway. The number of cycles used can vary depending on the patient's specific needs, ensuring that the therapy is tailored and effective. Positive airway pressure adjuncts play a crucial role in respiratory therapy by helping to mobilize secretions and assist in treating atelectasis, which is the collapse of part or all of a lung. These devices work by increasing pressure during breathing to help open airways and loosen mucus. They can be effectively combined with other airway clearance techniques, making them even more efficient. For instance, pairing positive airway pressure adjuncts with directed coughing can significantly improve the clearance of secretions. One common type of these adjuncts is positive expiratory pressure, or PEP, devices. These are designed to create resistance during exhalation, which helps keep the airways open and facilitates the movement of mucus toward the larger airways where it can be cleared. Taking this a step further, oscillating PEP devices add a vibratory element to the pressure. This oscillation helps break up mucus more effectively, enhancing secretion mobilization and making it easier for patients to clear their airways. Overall, these tools are valuable components in managing airway clearance and improving lung function. Positive expiratory pressure devices work by creating a resistance during exhalation, which helps generate a pressure between 10 to 20 centimeters of water. This pressure is created as the patient actively breathes out against the resistor, which can be either fixed or adjustable. This mechanism helps keep the airways open and facilitate mucus clearance. Vibratory PEP takes this concept a step further by adding small interruptions in the airflow during exhalation. These interruptions cause oscillations or vibrations in the flow, which enhances the effectiveness of the positive pressure. These vibrations help loosen mucus in the airways, making it easier to clear and improving overall lung function. This combination of pressure and oscillation is what makes vibratory PEP devices innovative and beneficial in respiratory therapy. Positive expiratory pressure, or PEP therapy, has been shown through various studies to be just as effective as other airway clearance methods. One of the key benefits of PEP devices is that they allow patients to self-administer their treatment, which not only provides convenience, but also makes them a cost-effective option. However, it's important to note that these devices are not suitable for very young children, specifically those under the age of 3, as they are unable to use them effectively. This limitation is something we need to keep in mind when considering airway clearance options for younger patients. When using positive expiratory pressure, or PEP therapy, there are some important preparatory steps to get started. First, make sure you're sitting comfortably to help your breathing. Then, take a breath that's deeper than usual, but don't completely fill your lungs. If you can, hold that breath for a moment before you start exhaling. Now, during the actual breathing process, you'll exhale actively through the PEP device. The goal is to create a pressure between 10 to 20 centimeters of water, but it's important not to blow too forcefully. Also, keep your breathing rhythm so that your exhale is longer than your inhale, aiming for an inspiratory to expiratory ratio of 1 to 3 or 1 to 4. You'll want to do about 10 to 20 breaths like this. After completing the breaths, remove the mouthpiece or mask and perform 2 to 3 huff coughs to help clear secretions from your airways. This entire cycle should be repeated between 4 and 8 times, but it's crucial not to let the session go over 20 minutes to avoid fatigue. This approach helps improve airway clearance and supports better lung function. Let's talk about positive expiratory pressure, or PEP, and vibratory PEP devices, which are essential tools in respiratory therapy. First, we have TheraPEP, also known as threshold PEP. This device is designed to help improve airway clearance and strengthen respiratory muscles by providing consistent positive pressure during exhalation. Next is the flutter valve, a handheld device that combines positive expiratory pressure with oscillations. This combination helps loosen and clear mucus from the airways more effectively. Similarly, the a cappella device merges the benefits of PEP with airway vibrations, making it a valuable tool for lung therapy and mobilizing secretions. Then there's the Aerobica, which offers drug-free oscillating positive expiratory pressure therapy. It's an effective option for enhancing airway clearance without medication. Finally, Vibra PEP is another vibratory PEP tool that promotes respiratory health by aiding in airway clearance. Each of these devices plays a crucial role in improving lung function and helping patients manage respiratory conditions more effectively. Positive expiratory pressure, or PEP therapy, is a method designed to help patients improve their breathing by creating resistance when they exhale. This resistance helps keep the airways open, making it easier for air to flow and for mucus to be cleared. To support this therapy, devices like TheraPEP and Threshold PEP are commonly used. They provide measured resistance, allowing patients to perform PEP therapy effectively and consistently. Another useful tool is the flutter valve, a small and portable device that combines PEP with vibrations. These vibrations work to loosen mucus in the airways, aiding in its removal. Similarly, the a cappella device offers vibratory PEP therapy by producing oscillations alongside resistance, helping to clear mucus more efficiently. Finally, devices such as Aerobica and Vibra PEP are specialized for vibratory PEP therapy, designed to meet the varying needs of patients with different respiratory conditions. Together, these tools and techniques play a crucial role in improving airway clearance and respiratory function. Let's talk about positive expiratory pressure, or PEP, and the vibratory PEP devices that enhance respiratory therapy. First, there's the TheraPEP, a specific PEP device commonly used to improve lung function by helping keep the airways open during exhalation. Then we have the flutter valve, which is unique because it creates vibrations during exhalation, helping to loosen and move mucus from the airways. The a cappella combines the benefits of PEP with airway oscillations, making it easier to clear secretions. Similarly, the Aerobica device merges vibratory action with PEP techniques to support ventilatory therapy effectively. Lastly, the Vibra PEP is an advanced device that integrates both PEP and vibratory effects, providing comprehensive assistance in respiratory therapy. Each of these devices plays a crucial role in supporting patients with airway clearance and improving breathing efficiency. Here, we're looking at two types of high-frequency, positive airway pressure devices that help improve airway clearance and lung function. First, the intrapulmonary percussion ventilation, or IPV, is a pneumatic device that delivers rapid, small bursts of pressurized gas into the airway. These bursts occur at incredibly fast rates, between 200 and 300 cycles per minute. This high-frequency action helps to mobilize secretions and improve airflow effectively. Next, we have the Metaneb device, which also uses pneumatic power, but adds oscillatory percussive breaths during both inspiration and expiration. This means it provides vibration or percussion in both phases of breathing. Additionally, it creates resistance during exhalation, which can help enhance lung expansion and secretion clearance. The percussion rate for the Metaneb varies from 170 to 230 breaths per minute. Both devices use high-frequency techniques, but the Metaneb's oscillations and exhalation resistance distinguish it by providing more dynamic airway support. These approaches are particularly useful for patients needing airway hygiene and improved ventilation. Intrapulmonary percussive ventilation works by allowing the patient to breathe in and out through the device, while it delivers an oscillating pressure. This oscillation helps to mobilize secretions within the airways, making it easier for patients to clear their lungs. One of the key advantages of this therapy is that it's usually well tolerated by patients who are stable. It also offers a good alternative for those who have difficulty taking a deep breath, providing effective airway clearance without the need for maximal inspiratory effort. This makes it particularly useful for patients who might struggle with more traditional respiratory therapies. Intrapulmonary percussive ventilation works by having the patient breathe in and out through a device that applies oscillating pressure. This gentle vibration helps loosen secretions in the airways, making it easier to clear mucus effectively. One of the major benefits of this therapy is that it's generally well tolerated by stable patients, meaning it's comfortable and safe for them to use. It also offers a valuable alternative for those who struggle to take deep breaths, providing an effective way to assist with airway clearance without the need for forceful inhalations. This makes it particularly useful for patients who find other methods challenging. Let's talk about intrapulmonary percussive ventilation and some of its key settings. First, the frequency settings control how many high-frequency percussive pulses are delivered to the patient each minute. This is crucial because it adjusts how often the lung inflation and deflation cycles happen. Next, the amplitude control manages the pressure level that the patient receives during ventilation. Proper pressure is essential for effective therapy and patient comfort. Then, we have the gas source options, which let you choose between air or oxygen depending on the patient's needs, or you can turn IPV off completely to stop the therapy when necessary. Finally, the digital display provides real-time data, showing mean airway pressure, pulse frequency rate, usage time, and pulse amplitude. This helps clinicians monitor and adjust treatment accurately for the best outcomes. Let's talk about intrapulmonary percussive ventilation and its key controls. First, the frequency control sets how many high-frequency percussive pulses are delivered to the patient, essentially controlling the rhythm of the therapy. Next, the amplitude adjustment determines the pressure level that's applied, so it's crucial for ensuring the patient receives the right amount of support. Then, we have the gas source selection, which lets us choose between air or oxygen depending on the patient's needs, or even turn off the IPV therapy entirely. Finally, the digital monitoring display provides real-time feedback by showing important parameters like mean airway pressure, pulse frequency rate, usage time, and pulse amplitude, helping us closely track and adjust the therapy as needed. The MetaNeb system offers a comprehensive approach by combining lung expansion, secretion clearance, and aerosol delivery all into one integrated therapy session. This means patients benefit from multiple treatments simultaneously, improving efficiency and outcomes. It operates in two distinct modes: CPEP, which stands for Continuous Positive Expiratory Pressure, and CHFO, or Continuous High-Frequency Oscillation. These modes are designed to assist with maintaining airway pressure and mobilizing secretions effectively. Additionally, MetaNeb includes a dedicated aerosol delivery mode, allowing targeted medication to be administered during therapy. This integration makes it a versatile and powerful tool in respiratory care. MetaNeb is an integrated therapy solution that brings together three important treatments into one seamless session. It combines lung expansion, secretion clearance, and aerosol delivery, making it a comprehensive approach to respiratory care. When it comes to lung expansion, MetaNeb uses two key mechanisms: CPEP, which stands for Continuous Positive Expiratory Pressure, and CHFO, or Continuous High-Frequency Oscillation. These help to open up the lungs and improve ventilation effectively. Additionally, MetaNeb features an aerosol delivery mode, which ensures that medications are delivered efficiently right where they're needed in the lungs. This combination makes it a powerful tool for improving patient outcomes through streamlined therapy. High-frequency chest wall compression devices, or HFCWC, are designed to help clear the lungs by using oscillations. These devices consist of a variable air pulse generator connected to a non-stretch inflatable vest, which the patient wears around their torso. The generator inflates and deflates the vest rhythmically, creating pressure pulses that cause the chest wall to oscillate. These oscillations are important because they help move mucus and secretions forward in the airways, making it easier to clear the respiratory pathways. Some well-known examples of these devices are the Vest, Smart Vest, Encourage, and a Flow Vest. High-frequency chest wall compression devices are quite versatile and can be used both in hospital settings and at home. Typically, a standard therapy session lasts about 30 minutes, and patients may need to perform these sessions anywhere from 2 to 6 times a day depending on their needs. The therapy works by delivering vibrations at frequencies between 5 and 25 Hz, which helps loosen mucus in the lungs. It's important to adjust the settings to ensure the patient is as comfortable as possible throughout the treatment, as comfort can really impact effectiveness and adherence. High-frequency chest wall compression, or HFCWC, is a therapeutic approach commonly used in respiratory therapy to help clear the airways. The devices used for HFCWC generate gentle oscillations and vibrations on the chest wall. These movements help loosen and mobilize mucus within the lungs, making it easier to clear. This technique is especially valuable for patients with conditions like cystic fibrosis or other respiratory disorders, where mucus buildup impairs lung function. By improving airway clearance, HFCWC can enhance breathing and overall lung health in these cases. Immobility plays a significant role in the development of complications for patients with chronic diseases and those who are hospitalized. When a patient remains immobile for extended periods, it can worsen their condition and delay their recovery process. On the other hand, early mobilization is highly encouraged because it helps minimize these complications. It's not only beneficial for overall health, but also works alongside airway clearance techniques to support more effective breathing and recovery. Encouraging movement as soon as it's safe can make a big difference in patient outcomes. When selecting airway clearance therapy, it's important to focus on several key indicators to assess how well the therapy is working. First, look for changes in sputum production, as this can tell us if the therapy is helping clear mucus effectively. Listening to breath sounds also provides valuable insights into lung function. Equally important is the patient's subjective response. How they feel after the treatment can guide adjustments. We should also monitor vital signs to ensure the therapy isn't causing any adverse effects. Next, evaluating diagnostic metrics is crucial for measuring therapy efficiency. Changes in chest radiograph results can show improvements or complications in the lungs. Likewise, arterial blood gas values help us understand the patient's oxygenation and ventilation status. Monitoring oxygen saturation levels gives immediate feedback about the patient's respiratory status and response to treatment. Finally, it's essential to regularly reevaluate the frequency and appropriateness of therapy orders. For hospitalized patients, this should happen every 2 to 3 days to keep care aligned with their current condition. For those receiving home care, reevaluation is recommended every 3 months. And anytime a patient's health status changes significantly, their therapy plan should be reassessed to ensure the best possible outcomes.